How to tell bruising from infection after surgery. Have you recently had surgery and are now wondering how to tell if what you see is just bruising or something more serious like an infection? This is a common concern for many patients. Let's break it down so you can feel more confident about your recovery. After surgery, it is normal to see bruising around the incision site. Bruising occurs when small blood vessels break under the skin. This leads to discoloration that changes color as it heals. Initially, it may appear red, then progress to purple or blue, and eventually turn green, yellow, or brown. Typically, this healing process resolves within 2 weeks. You may also notice that the pain associated with bruising lessens each day. On the other hand, an infection at the surgical site presents different signs that requiring immediate attention. While some redness and mild swelling around stitches can be normal, infection usually causes worsening redness that spreads. You might feel warmth to the touch, increased or persistent pain, and swelling that does not improve. Infected wounds may produce thick, yellow or green pus and can have an unpleasant smell. Other symptoms to watch for include fever, body aches, or a general feeling of being unwell. If you see red streaks radiating from the wound or experience worsening tenderness, stiffness, or numbness nearby, these could be warning signs of infection. To help you differentiate between bruising and infection, consider these key differences. First, the color and progression of bruising is predictable. It fades over time, while infection redness tends to intensify and spread. Second, pain from bruising decreases steadily, whereas pain from infection often worsens or persists. Third, bruises do not produce pus, but infected wounds may leak thick, colored fluid. Lastly, symptoms like fever, warmth around the wound, and swelling beyond mild irritation suggest infection. If you notice that your bruising is unusually large, very painful, or does not improve within 2 weeks, or if you develop a fever or excessive swelling, it is important to contact your healthcare provider immediately. Early identification and treatment of infection can help avoid complications. In general, mild bruising, some tenderness, slight swelling, and small amounts of clear fluid or mild oozing are normal parts of healing after surgery. Practicing careful wound hygiene, following your doctor's instructions on bandage changes and showering, and monitoring the wound daily will help you distinguish normal healing from infection. If you are ever in doubt, do not hesitate to seek medical advice to ensure proper care and recovery.